Chamgach tab kalenjin ogo itagat in tab health watch kaine nyungo Karen Chepkoech embe tab raini kemiten Top Hill Hospital ole gimege koen kaimutik ab metit anango brain tumors kimiten ak Dr. F Koech.
Miendo na affect the brain yani nango mi clots yani ibwane the brain koebwa kuchile kundit kuchile brain koyachil kokonu kinekuren symptoms yani iboruge amun kakochil the brain muche koborge amun kaam chito metit so kinekure chronic headaches yani metit naame chito continuously nemastopeni for more than 2 weeks yani koib kasarta nekoi ala komuche koborunenge mara kakor chito yani masoito konye komie ana ko sait age komuche koborge en kit nekikuren seizures kit nemoche kou epilepsy. Those are symptoms chebo a tumor kele kako irritated the brain ko irritated kokonu symptoms.
Tos mi kiy age neimuche kokosen a tumor?
Mpaka sai komanayat komie. Some of these things were known. Amun kikiyai research en emetwek chechang, Europe, America, a lot of research. Lakini tomo kenai ine komie. Mi tukun chekikuren hypothesis yani theories. Some of those theories ko mara amitwogik, mara tukuk chekikuren radiation yani iniku exposed ak radiation cheu chabo machine nabo cancer. Tukuk alak ko mara ko exposure to environment ko asista zaidi, especially UV light. Others ko genetics yani kikisikten cheitu kityo. But majority ko makingen itu kityo. Yes.
In Kenya, what is the prevalence about tumors?
In Kenya ko kotesak kabisa. At the moment, before many years ago, kuki brain tumors kuki mi ngweny mionwogik tugul ingeyai statistics. But of late ko kotesak. At the moment, ko inyoru chito nendo a brain tumor about 5 people in 100,000. So you get it barak. And this is continuing year after year. You get it, this is die. So as doctors, we are thinking, mara mi tukun chuo ko change nag in Kenya. Mara ko mitwog, mara ko chemicals chebo CNB, we don't know. And especially, chongi BTC and pesticides, capture crops. Sana ko boisien bik tukuk cheu Roundup, kebar weeds. Ako those chemicals kochute soil, sitting cover water, because our water go originated from somewhere. At the end of the day, you drink that water. Or mara go toxic levels komi barak lakini mtomo kaya analysis kenai. Anago chego, you know, the cows graze, you go give it. In the process, go concentrate that chemical and milk, and you drink the milk. So those are theories that at the moment we are trying to study again. Are they things me, our environment, and I think those are things that make you more careful.
One of the symptoms called migraines and headaches. Yes. Imuche identify nigo just a normal headache and annual or further checkup. Most of the time, ko self-medicating when it comes to simple things called headaches. Kora younger when you're a patient aigere kole rahisi kotindo tumor, what are the steps you take when it comes to testing?
My advice go headaches. Nigga persistent. You know, imuche inyoru headache. Kwa mimi headache 1-2 days ago stage, that's okay. Lakini headache ni mabete kila siku komi headache. And the period go more than 2 weeks. That is a serious headache. Nenyalo keyai uchunguzi. Many times kubwana biik kokakoik too late. Kikwame chito for 6 months. By the time goitu kokikokor makokere ana makolugui tuguk, yani kokoik advanced the symptoms. So the first thing ko headache. Ko persistent headache iwe get daktari. And the doctor ko analyze ne kot konai kole this headache konyalo takeyachi uchunguzi komie. Kebir pichait koboru kot komi shida. And many times kot kaya kounon kosip kenyoru mara kot tumor koto mingin. Lakini at the moment we get tumors cheechen kabisa kikobur kot kikoet kot kikwam oleo in kundit.
Can you mention something about advanced symptoms? Temuche mwach more about that?
Yes, you know, some symptoms muche ko kere chito komakokere komie. Kamis chito metit. The next symptom may be sight, makokere komie, but still kwendi kwale kwame Panadol ana kole mache kikeng'wan konyek amu masuitoi komie. Yet the problem ko mara ka tumor na kot kichere kowekse kot kokerta chito komie. So advisable keger daktari mapema. Kobit any symptoms ne suspicious komat kwam chito Panadol. Amu Panadol kobo pain kityo, isto uchungu. Lakini master the cause nebo that headache. So you'd rather treat the cause nebo the headache than to treat the symptom.
So kagonyo patient iger kole rahisi kotindo tumor, brain tumor. Yochini test yechon si confirm kole.
Okay, kit netai ko keyai examination. Physical examination. Mi kikinet daktari ko checken certain things in borto. Nange picken things che suggested kele mi mara smell, mara konyek, taste. So there are symptoms we look for. And those signs, symptoms and signs are what will entail kutagea uchunguzi. The next thing after kage examination, kotko suspicious kele mi brain tumor, got the first thing ko gebir scan. CT scan got the basic. CT scan go boru amoni boru metit komie ako boru kot komi shida age tugul en kundit ko boru. From then on ko kimuche keyai advanced testing chekuren MRI. MRI now go boru saidi kosir CT scan amun iboru in 3 dimensions, yani 3D. That way ko rahisi ikinyoe chito kenai kele unias.
Une kanyoiset?
Kanyoiset kotiengei kit neu that tumor. Mi alak chekimuche kinya ak kerichek kot kisib kenyor mapema. Komi alak chekikochi chekuren hormone therapy, especially chekuren pituitary tumors kimuche kinya ak kerichek. Lakini chechang konyolu keyai operation sikicher. Operation kotiengei kora the location nemi daktari ak facilities chemi. Kikoit technology siku hizi kimuche keyai operation keboisien oret nema lazima kele kakiyan metit. Muche kebun a small area, minimal invasive. Kimuche kebun through the nose. And again, just above the eye. Those are minimal invasive surgeries. And then other operations, kimuche keyat the skull, sikeiti yemi the tumor. brain is very delicate now. Very delicate, so surgery itself is delicate kora saidi. Among every bit of the brain couldn't function. So, igetwat kidogo komuche kobit kit nekure deficits. Deficits ko tuguk cheu mara kabet smell ana magere chito komie. Those are deficits and it can happen after surgery. But with technology, gigabit technology, advancement in technology, ni go minimize effects cheu choto kele after surgery komuche ko maboishe neut ana maboishe keldo. So as doctors, we try to minimize those side effects or the residual side effects. But as I said, technology has helped at the moment. Kendai technology na mibarak. Nikimuche gebund a small area agichira big tumor. Yeah, that way we minimize complications. So people actually after surgery kungete chito akotestai kasinyin kawaida. A few cases komuche kobit complications kotiengei kit neu that tumor. Sometimes the tumor go kiruen a very important structure neu a blood vessel. So as we try to remove it, komuche kobit a complication.
And in after treatment, the process of recuperation of patients, me 10 precautionary steps cheta moini the patient.
Yes, of course. We always try after surgery, doing heavy work or straining, or in some surgeries, we could go sneezing because that can open up the wound inside. So there are a few precautions where the surgery is done. Surgery go chang so there are many surgeries. So each conduct precautions
What happens when a tumor recurs?
Some tumors their biology. Me tumors even if you try to remove, some will recur. So tumors, some tumors have the tendency to recur, even if you remove, and always, if tumor in laboratory, recurrence. Others go malignant. Malignant means cancer. Those ones, whatever you do, they will always recur because they have the tendency to recur. So the biology of the tumor is the one that determines the recurrence.
You might talk on your surgery about tumors. How much should they expect to be charged? Kora catering insurance is true when NHIF?
Yeah, so far NHIF has been very useful. About NHIF, almost 80% of the cost as it is now, unless it change in future. But at the moment, NHIF is helping everyone. Tagomi NHIF card. So we use NHIF. Some people may have to top up kidogo, kutienge gora how the surgery has gone, and how long the surgery in theater. Some cases go more, sometimes we do for 16 hours, others go 8 hours. So take the length of the surgery, and that will determine the cost. But as I said, 80% go paid by NHIF.
Mitten injuries, head injuries. More kidogo about the injuries types, causes.
Yes. Head injuries in our country are very common and rampant. Our environment. The majority road accidents. And all that there are so many accidents. And there are few centers handling head injuries. So mara kakwera metit anagabot kokwera ngwenye lam and motorbike accidents. Chikogoik more common ko motorbikes because kogoik a very cheap way of transport and everybody go boisien motorbike. So unfortunately, ko biik chechang ko maloche helmet. Helmet saves, but most people don't wear helmets. So ikobitana ajali komiani metit zaidi because you're thrown off. Kukwere ngweny metit. Kukwere ngweny metit kosiche injuries. So it can be blunt head injury and a penetrative head injury. Penetrative korut key through the skull into the brain. Those ones also can occur in maybe gunshots, through with a bullet, through the skull into the brain. But the majority of head injuries go from accidents. Mi kora chebo fights, mara kakikwer chito ak panget through ana ketor ak rotwet. All those, although the percentage ko mi ngweny, the bigger percentage go accidents from motor vehicles and motorbikes. Koumian metit komuche koumian the scalp, yani ngozi, ana koumian the skull, imuche koye in pieces, ana ko cracken into a long crack. Ana koumian the inside. Koumian the inside, kumi layers of the brain. The first layer got the covering of the brain, dura. Between the layers of dura, kumi tigit chebo korotik, chemuche koyesa, and that can bleed. And most people die because of bleeding. Amunga bleeded. Among those vessels conduct a lot of blood and they can bleed quickly. Now, side I go me and the brain, the brain laceration, and I go bleeding into the brain. Yeah, so those are the categories of head injuries which can happen because it's that. So every picture, every CT scan, which kind of injuries, and so the focus changes to whatever the injury. Could go bleeding, so we focus on the bleeding, and we cut the skull or get at the bleeding.
And in the skull.
Skull, we can repair it. We either repair. Me, catches, check it, position, can repair the skull, screws. Yeah, and we can sometimes get the whole skull. Again, a new one. We can make new skull, artificial cement, and that can make a new skull kawaida too. No, the normal skull.
And what of the blunt injuries?
Now, blunt injuries the impact. Sometimes so the impact is what determines the extent of injury. Many times, into coma, and that one will need ICU care, maintaining ventilation, to get reducing the swelling in the brain. Because the problem can swell in the brain. And remember, the skull got a rigid box no more expanded. So you go about the brain, space expanded. In the process, there could be two complications. So from the time plasma got reducing the swelling using drugs and machines, ventilators. One, take precaution. Maja you chita in motorbike, he'll trained and I'm trained. Sometimes go mucho kogata chita motorbike. No man know what to do in the event of an accident. So try call the right person and training, get training, could your license no motorbike. Two, mainline motorbike and main large helmet. Helmet will save you. Mabigine helmet. If you have to climb a motorbike, large helmet. Because in the event of an accident, that is the only savior in authority. Kita mamache ke line pikecha. Mache go one motorbike will launch it again. Mamache ke launch a big sumugu and a big one because that increases the risk of an accident. The complications increases tremendously when the people are thrown out, many of them come here to Saidi. Speed. When you're in a motorbike, you the rider kumat Saidi. Majority of accidents go because of speed and carelessness. Me features what's called a benign tumor. Benign kuma cancer. Kuna cancerous a cancerous lesion. So malignant cancerous lesion. So a benign lesion, a benign cancer, or a benign tumor, localized, yani kibur ko round. Kone cancerous ko usually ko infect in tissues, yani to the roots to get into the brain. So those are the issues. So you can, although when you look at it physically, but in the lab, they identify which one is cancerous or which one is not cancerous. I think the advice is people should seek help as soon as possible. Among major email, got to zip your test curable. Again, got keyboard got 2 months down the line or 3 months, are too late. So the individual should know the early the better. Yeah. Or got the way, it will get worse with time. So it's better if it's hospital mapema, sige analyze and got 2 marks of teacher and as get audited mapema. Yeah. Where I trained in Australia, tumor 20 years ago, because kisip kenyoro, suki analysis, sip kechegeni, yeah, I think the challenge is people come too late. You know, when it's already too late. At that point, come out of the side. Yeah, act checkups. You know, every year is important. Coach it as a thorough checkup of all the organs. That way, you something very tiny, Kenya. Yeah, but you see, in Africa, that could be that problem. And then now you go to hospital. It should be the other way around. Cases are very challenging and they come in different styles. But I think the most challenging, one of a university professor, something called an aneurysm, a brain aneurysm. An aneurysm is a balloon from a blood vessel in the brain. And this one was very deep, with a posterior circulation, and very deep and very far. And unfortunately, Giago ruptured and Giago had this aneurysm. And he came to hospital in a critical state. And so my team, we started very, very late in the night because it was critical, at about 8 p.m. in the evening. And we operated for 24 hours because that tumor, that aneurysm was so large and we could not, what we call clipping. And he was bleeding. Even after opening the brain, he was bleeding like a tap. And my colleagues, the anesthetists, worked so hard. We transfused almost 15 units of blood, and we continued until my nurses all collapsed. My assistant collapsed, could not continue anymore. And I remained alone for many hours. We tried to get for support from somewhere. It was difficult because we could not get somebody from Nairobi to come and help. And we continued. But we successfully clipped that aneurysm after many hours. And today he lived, he went home walking. And it was a challenge, but it turned out very well. There are many cases now compared to when I started neurosurgery almost more than 10 years ago. And I think the reason goes because of investigations. At least the government has done a lot in terms of delivery of MRIs. Now, MRI got me almost in every county hospital. Kogide CT scan. CT scan are going everywhere. Before then, gogi very hard the CT scan. Act two, the cost. The government is now meeting the cost of investigation for MRI or CT scan through NHIF. So it has helped. So now we are able to pick cases mapema than before. But largely, Orago, the cases have gone up because of the population. Act two, we think that maybe the environmental factors are playing a big role in causation of tumors. So we are seeing an upsurge of brain tumors.